Hello, this is Dr. Grande. Today I'll be talking about the difference between guilt and shame. And when we talk about these two terms, guilt and shame, I'm talking about them from the perspective of mental health treatment. Because outside of mental health treatment, they're often used interchangeably. Sometimes we might think of shame as being a word that carries a bit more of a negative connotation than guilt, but generally they're looked at as fairly similar. In mental health treatment, they have different meanings and they're distinct. So we can think of guilt as an awareness. It's an awareness when somebody has done something wrong. It's about a standard that's violated or a behavior that's done. It's not about the person themselves. So when we think of guilt, sometimes we think of when somebody says that they've done something bad. When we think of shame, we think of somebody saying they are something bad. They identify. So shame is about the person. Shame is a feeling of pain that we think of most of the time as occurring after a feeling of guilt, although it's not always in that order. So shame is personalized. When we think of guilt, we oftentimes think of a feeling of regret. And we can see that same thing with shame, that feeling of regret. But with guilt, there's a call to action. There's ownership and responsibility. There's a pressing need with guilt to fix whatever it was that was done wrong, to right the wrong. You could think of guilt as revealed. Somebody who feels guilty usually wants to tell somebody and fix what happened. And shame is concealed. Shame is internalized. And typically, people that feel ashamed don't mention that feeling to a lot of people. It is, after all, shame. So by nature, it's about that person. It's a feeling they have about themselves. So it makes sense that they wouldn't share that with a lot of people. Guilt is about the action. So can we have shame without guilt? Generally, the answer is no, but there are exceptions. For example, when looking at mental health disorders, if we consider the disorder narcissistic personality disorder, it's not unusual for individuals suffering from NPD to feel ashamed but not feel guilty. That's because guilt requires a degree of empathy that sometimes people with NPD don't have. A characteristic of that disorder is a lack of empathy. As a matter of fact, we would expect many people with NPD to feel ashamed and have trouble with the guilt piece, have trouble experiencing guilt, having that awareness. So, is shame bad? Generally, we think of shame as bad and guilt as good, but there are exceptions. There is a degree of shame which is normal and natural, and there is a degree of guilt which is unhealthy and unproductive. We call it inappropriate guilt. And inappropriate guilt is not unusual for people that suffer from depression. The reason we usually think of shame as bad is because, first of all, as I mentioned, it's internalized. It's also an overgeneralization. It's taking something that was a violation of a standard and making it about oneself. So it has an irrational component to it that we typically view as unhealthy. We also know that shame can lead to depression. It can lead to substance use. It's been associated with violence, including bullying, and violence directed toward oneself, suicidal ideation or behavior. So we generally do think of shame as unproductive and something that should be the focus of mental health treatment. Guilt, on the other hand, is usually thought of as being good. And of course, there is inappropriate guilt, which we would think of as bad. But the reason we tend to think of guilt as a good awareness, a good feeling, is because it tends to lead to change. It tends to lead to some corrective action. And if someone's feeling guilty, it indicates they have empathy. And we typically think of empathy as a positive characteristic. I hope you found this description of the differences between guilt and shame to be interesting. Thanks for watching.